ready?
Go.
Okay. There are a few videos of me doing this already, but just for the sake of modifying it and bringing it up. So there was a question over treating anxiety, stress, helping improving sleep patterns, and then add-ons such as helping with migraines and headaches. So once you learn the general neck routine, like everything I teach you, this is a modification of herbal medicine using meridians. Body space medicine is a modification of herbal medicine treating the movement of chi. Tuina is massage with points and then modifications of combinations of points to treat something. Does that make sense? So never overcomplicate the medicine. You will not be successful if you throw too much at your patients. Trust me, too much is too much. In the beginning, I used to do kinesiology, repatterning, testing, massage, cupping, acupuncture, and cranial, all in within an hour. No time for the body to actually assimilate that information. But I did it because I thought it wasn't good enough. Now I just stick needles in people and let them fucking lie there and stew. Amy knows all about that.
And you run down the corridor, burst into the room,
Yeah.
yelling at me about Leitrim.
Yeah, Leitrim. Okay, so I start with just putting the cream on. So I'm just going to use a bit of lotion here, bit of balm.
It puts the lotion on its skin.
It puts the lotion on the skin, it does the massage. So it goes on, and then I start to just pull it into these muscles. I'm thinking not just muscles, I'm thinking gallbladder meridian. I'm thinking Sanjiao meridian. Yeah. I'm thinking bladder meridian, and I'm thinking governing vessel. So whenever I'm treating, I'm thinking, what am I actually touching? And I start by making a wave. Yeah, so come down to here, and I lift it up. And I can use the edge to, if I'm not strong, I can use the edge of my finger this way to scoop. If I want to, I can also use my thumb this way, it's much stronger. The idea is to lift that lotion in. And I'm supporting her head, I'm rolling it, opening it up. I want it to be off the bench so I can get underneath. I'm using my whole forearm, I'm not just doing this, I'm using my whole forearm and I'm pressing with my body. I'm pressing into the bench, rotating. See my pelvis moving? So here it gives me more power. Then I come to the very top here, gallbladder 20, and I circle using Rofa. So remember your Rofa? This is the same thing with your little thumb. And I'm feeling the edge of a vertebra. How's it feel? Sore?
Going here.
So she feels another channel activated. She's got a pixie here, do like a little pixie.
Sure.
Spanish pixie. Human cat. So we're going to go down. You should be in that film Cats. You should see the new one coming out. So here we go. Yeah, where's it sore here?
Yeah.
Okay, so we need to be careful.
No, it's basically nasty feeling, but
Okay.
yeah.
So then here, Tuifa on the crest of the traps. Again, I'm not doing this. That will kill my thumb. I'm doing pushing. So the same as my Gumfa, same as my Tuifa. I'm doing this motion. See my whole arm moving? Yeah, not this. Moving. If I move my arm, her shoulder moves. Dredging. And I come back and I recheck. How's that feel now?
You better.
A little bit better. Okay, more dredging. Clearing the pathway. This is a gutter. Shove the leaves out of the way, move the stagnation. Shove the leaves out of the way, clear the gutter, move the leaves, clear the gutter, move the leaves. Yeah, keep going until she feels it. Still a little bit here
Hmm.
on the edge of the bone.
I feel smaller. No, it's
Like
like
a knot,
this.
yeah.
But it was like that. A kind of feel of liquid or something.
Mm-hmm. Now I can go to Anmian here, which is a point between the back of the earlobe. By this point here.
Last one was sore.
This one?
No, the other one. No, the other one. Yeah, more in here.
Or here?
Yeah.
Okay. Sanjiao channel, Sanjiao 17.
Oh, there.
Mm-hmm. I have a lot more movement. Not as discomforting. Still a little bit.
Yeah,
here.
well, yeah, go ahead.
Mhm. Let's check the other side first before we do any more. So I'm going to put the lotion on again. Same routine, just repeating what I just did. No change, but just on the other side. So again, getting this movement going. It's like a wave. So I'm using, I have kind of bendy fingers anyway. I kind of go like this, and I'm using that motion outward, inward, yin yang. I suppose in the West they'd see this as kind of like a lymphatic drainage, but in the opposite direction to where you're supposed to go.
Mm-hmm.
And then I'll do circular movements. Bit tender again in a similar spot. I can feel the tension. And I'm going along the vertebra. I'm feeling the edge of her vertebra. You know, so there's vertebra, there's 3 bones. Sticky outer bone, 2 lateral bones. Yeah. Lateral, let's go. Oh. Spinous process, vertebral process. Okay, more dredging. Tuifa to push therapy, pushing the method, pushing the skin, pushing the muscle away, pushing. Rofa, circling, kneading, going down the neck, removing stagnation from her head, thoughts, anger, hatred, frustration, too much thought. Clear the neck. Allow the brain to relax. Brainstem. So now I check in here. Okay, all good. Maybe she has insomnia, not able to sleep. Maybe.
No.
You can sleep?
Yeah, no.
Cool. But if I was treating insomnia, I can go to Anmian and I can use my vibrating finger, like the Junfa, and just what I'm doing is contracting and relaxing, like I'm making a tremor. And I can take, in this area is around C4, and Bailey-Au is the extra point, good for neck stiffness. I can hold that point, roll her head onto it a little bit more. This would be like halfway down the neck, around C3, C4.
Mm-hmm.
Gently
Can be
press.
really painful sometimes.
Yeah, just gently hold it. And I'll wait for Kat to just kind of give me the neck. So I'll feel her head go. And I can repeat on the other side. Again, approximately halfway. Feeling for the hardest area of the bone there. Gently pressing.
Are you pressing?
Mm-hmm.
No.
Not as bad on this side, huh?
No, I feel it more here.
Mm.
It's like you're pressing now stronger than the other side.
Mm. Sorry. And then I contraction by holding her neck. So I scoop my hand, pressing. This allows the neck to stretch, but I'm using her shoulder rather than pulling her head and pushing her shoulder away from her head. Being careful as a man where I put my hands here. Repeat on the other side. I bring her head over this way gently. Lay my hand on top of her ear, this way, forearm, and stretch again. This time a different muscle group, different channel organisation.
Yeah, that's the one is tight. It's more intestine, no. What is this? No.
This one?
Yeah.
A little bit of sanja, a little bit of bladder, a little bit of gallbladder, a little bit of everything actually. It's like levator scapula, scalenes. So if she's also a little bit having mental health issues, trouble sleeping, aggravated, we will work yin tang, third eye, and across, stomach 8. Good for clearing brain fog, stomach 8. That's the devil's horns, they call it. You'll feel like two big dips here on your hairline. if the person has chronic daily headaches or migraines, we work the gallbladder channel here, and we use this kind of sapphire scraping friction. Draining the liver channel, the gallbladder channel, that's what we're doing, draining it, physically draining it. Overthinking, over planning, over organisation. Some people find it incredibly painful, others find it like uncomfortably nice.
Exactly.
You have to kind of have a cat's claw, 3 prongs here. You can feel the tension in the skull. See the skin, watch the skin colour. Watch, tell me what colour it is. You see the skin colour? Watch again.
Wait.
Look again. Watch your skin. I'll take the edges of my fingers here. We do salt and pepper. You pour pepper onto something or salt, makes that sound. Clearing Tai Yang. Then now we'll come to Barhway, which is the biggest, deepest point on the apex of the head. Follow the very top of the ears, the very tip, the ears, and come round to the top and palpate around until you feel the big dip in the top of the head. That's where the fontanelle should have closed. Never fully does. And in the center is the earth point. Okay. On this side is wood, which is actually opposite side to the liver, and this side is metal. And at the front, which is these are all about a finger width away. The front is the heart, fire, and the back, water. Yeah. It's just like a 4-pointed star. It's called Shi Shen Kung. Shi Shen Kung means 4 spiritual blah shens.
Technical name.
Yeah. 4 spiritual blahs.
Spiritual shite.
Yeah. And I find when I do these points, I press them, some of them are more open and some of them are more closed. Pressing these is good. It was traditionally a treatment for schizophrenia. And again, I use my whole body, pressing, release, press, release, press, release, harmonizing the head. And then I'll finish with my knuckle here. This is Ija-chan, but it's easier to use than doing this, because sometimes the skin's so delicate, your thumb nail can leave an imprint. So if I use my knuckle this way, If I want, I can massage the ears, which is good for circulation of the kidney chi. If you're using cream, just a small amount, be careful. Some people are allergic to the creams on the ears.
No, I have shiverings here. I'm telling you. Like niggly things around here.
No, this is called Nyanfa. Nyanfa. Good for removing. Sometimes when we treat people or when they're busy in lives, their chi stagnates a lot and it causes head problems. And if you must just massage the ears and the sinuses, you can clear a lot of stagnation. You know, I like the ears because they're like the whole body in my hands. And then if I want to really just bring her in to me, I'll do Genfa, which is my vibration, like we did before, with my whole hand on top of her head, staying in my body, planted, breathing. That's kind of a very comprehensive head and neck treatment. There are variations on that, holding points and these things. That just gets the person into a good state overall for whatever you want to do next with an acupuncture or stomach protocol. Good for insomnia, good for hypertension.